see patients with chest pain or breathlessness, sometimes with palpitation. As far as cardiac surgery is concerned, it is a major procedure and a life-turning event for every patient and their family. Heart disease is a major problem in India, and when we look at the recent trends, there are a lot of young people who are affected by heart disease. At KG Hospital, we provide the latest technology and care to make a patient's journey through a hospital easy and safe. I am Dr. Arun Kumar, Cardiovascular and Thoracic Surgeon, KG Hospital, Coimbatore. I would be discussing about a few problems which my patients come and tell me every day. I see patients with chest pain or breathlessness, sometimes with palpitation. So most of their problem is related to either a block in the coronary arteries, which may require a bypass surgery, or a damaged valve which is present in the heart, and they may require a valve repair or replacement. As far as cardiac surgery is concerned, it is a major procedure and a life-turning event for every patient and their family. There's a lot of apprehension when it comes to cardiac surgery. They still fear if they could make out of it, if they could return to their routine, if they would be able to continue their activities, if they would be able to really provide for their family, if they would be a really meaningful person in the society after cardiac surgery. Now, when I see patients who are really afraid of the surgery, I tell them, is it the surgery you're really afraid of or the disease? I would say the disease is more dangerous, but none of them get to realize it. The surgical procedure is a small portion of, or it is a small event which happens during the course of their treatment, and we are able to restore the anatomy of their heart to a normal way. It functions to a normal way, but then the onus lies on the patient to make sure the disease does not reoccur. So cardiac diseases are not like surgery where you can get it done and then everything is cured. It is an event which is life-changing, that puts you in a position that if you do not change, then you are going to have the disease again. Cardiac surgery, especially coronary artery bypass surgery, has been in the increase lately in India, mainly because of the westernization or the western lifestyle which we adapt. Heart disease is a major problem in India, and when we look at the recent trends, there are a lot of young people who are affected by heart diseases. It is mainly due to their lifestyle and the food habits which they have that puts the young people at risk. Heart surgery is considered as a major life-turning event, and most of them fear it just for the fact that if they would be able to return to their normal after the surgery. The major causes for a heart problem, that is a block in the coronary artery, are modifiable and non-modifiable risk factors. The modifiable risk factors include the most common factor which leads to a heart disease is smoking. So if you are a smoker, then you are most likely to have a heart problem, especially a heart attack, and then suffer because of it. Alcohol consumption, having a relaxed lifestyle, diabetes which is uncontrolled, hypertension, having a lot of stress at work, not taking adequate rest, being obese, or having less physical activity, or a sedentary lifestyle are all risk factors for heart diseases. These can easily be modified You just have to wake up in the morning, go for a healthy walk, 3 to 4 kilometers of walk, if possible go for a jog, do some yoga and also some meditation, which would definitely calm your mind. And don't be in a hurry to go to your job. Take a relaxed ride, go to your job, and if your passion is towards your job, then you're not going to feel stressed out in your job. So make sure you love the work which you do and stay there. Don't be stressed every day that you're going through a laborious process to meet your needs. That would add more stress to your life as well as your family, and thereby putting you at risk of a heart disease. Rest is equally important. We need at least 6 to 8 hours of rest in your prime, and the more you rest, the better for you. Of course, 8 hours of sleep should really make you fresh and healthy as well as ready for the next day. Food habits have to be very stringent. You need to take more of vegetables, less of junk food, or completely avoid junk food as far as possible. Try to avoid restaurants or food taken from outside and have food which is prepared in the home. Avoid taking oily food. Most of these patients who develop a chest pain rush to a hospital and they are diagnosed with heart disease, and I would tell you, your life does not end there. They have an angiogram done, and if you are diagnosed with triple vessel coronary artery disease, we are there to provide the best care for you. Cardiac surgery for years have saved many lives. At KG Hospital, we provide the latest technology and care to make a patient's journey through a hospital easy and safe. Minimal invasive cardiac surgery is a latest technique by which the heart surgery can be performed without cutting through your breastbone. It is done through making a small incision on the left side of the chest, just below your nipples, and the procedure is completed without cutting across any bone. So after the surgery, the patient recovers very fast. There is minimal pain. Your return to activity is much earlier. The chance of getting infected is minimal. The requirement of blood transfusion is minimal. Patients with diabetes or smoking habits recover much faster and experience less pain, and it's a very safe procedure. At KG Hospital, we have completed more than 300 surgeries, and it is a very safe procedure and it's a standardized procedure. I would recommend every one of you to get yourself checked at an early stage for heart diseases. Get yourself a master health checkup, get an ECG, echo, and if required, a treadmill test as advised by your doctor. And if there is any differences and your doctor would like to have an angiogram done, please get it done at the earliest. There are a lot of patients who need treatment in the form of lifestyle modification and just medications. So these patients can avoid a heart attack. They could lead a peaceful life. They could live a trouble-free life if you get yourself diagnosed at an early stage. For patients who have diabetes, they do not experience pain and they may have a heart attack which they have not experienced or felt. It is called a silent heart attack. And in those occasions, when you get a master health checkup and then you get detected with a heart attack, consult your cardiologist, consult your cardiac surgeon, and if they advise you to go for an angiogram and a stenting or a bypass surgery, do not hesitate. Technology has developed so much that you can have a pain-free surgery and then go back to your normal activities in 15 days time. Thank you.